Hoping to avoid an amputation in your dog with osteosarcoma? Cementoplasty might be the thing you're looking for.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Welcome, Dr. Shaina Stewart and Dr. Aqui Villamonte to Dog Cancer Answers. We're so pleased to have you with us today.
Good to be here.
Thank you for having us. Yeah.
Now, I know that Dr. Villamonte, you asked me to call you Dr. Aqui. Is that okay?
Yes, it's perfect.
Okay, good. And Dr. Stewart, is that all right?
Perfect. Yep.
Okay, great. Yeah. So we're talking about cementoplasty, which just sounds like the most incredible, simple solution to bone fractures that I can imagine. Like, why don't we just put cement in it? So I was wondering how this happened. Who came up with this brilliant idea? Who was creative and flexible in their thinking enough to come up with this?
Well, this is actually a technique that comes from the human medicine. And we are now, since a couple of years, starting to implement in veterinary medicine. And in the United States, Dr. Stewart is the pioneer. But the first reports of cementoplasty date of the 80s, 84, I think it is. And it started in human medicine for the vertebroplasty to fill cavities caused by tumors or metastases of tumors, or even in cases of compression fractures. It's quite used also. And it's usually used with PMMA, polymethyl methacrylate. It's a special bone cement that becomes quite hard. And that's what the cementoplasty is in a nutshell.
I love it.
Ironically enough, that's how I came to discover it here in the U.S. A friend of mine is a medical assistant at a spine and radiology center, and she was telling me about the kyphoplasty and vertebroplasty they were doing for osteoporosis with compression fracture in people.
That's like in the upper spine and the neck, sounds like.
Anywhere in the spinal cord. As bones get weak, older people are really susceptible to just compression fracture.
Yeah.
So she was telling me about this, and I was like, I wonder if there's something like that in dogs. And I was like, oh, look at this. And it just, this was February, March, and I looked, or it was,
of this
year?
Very
close to when it became available in the U.S. Actually, the first one I did, last year. The first one I did was in early December, I believe. So it was just a few months prior that I had discovered everything. So the timing really worked out.
That's really cool. So just so that we're clear on the timeline, when did you first discover, what month did you first discover cementoplasty?
I want to say November.
This is really new. In the US.
In the US, certainly.
Yeah, in Europe it's also very new. We had a different formula of the product before, and we launched it in June of 2021. And in July of 2022, we launched the new formulation, which is ready to use. So in the previous version, you had to mix it yourself inside a syringe and then push it in.
Okay.
And the setting time was not forgiving. You had to do things very fast. And then we changed the new formulation, which is much more ergonomic, in which it comes ready to use in a syringe. You just have to connect the adapters and inject. And,
wow.
That gives you a prolonged time, so it's much more workable. And allows the vet to really, while they perform the cementoplasty, they can evaluate the filling with radiographs or fluoroscopy, depending on what they have at hand.
And then go back in and sort of fine tune things if they need to.
Yeah. The idea is you feel a little bit and you check. You go a little bit more out. You feel a little bit more. You check. always on two views to be sure that you're feeling as well as in the front as in the back and to the sides. So it's a process. It can be time consuming, especially at the beginning when you are starting, but eventually you will get the hang of it. And yeah.
How incredible! So
well.
walk us through the procedure from beginning to end. Is the dog anesthetized? Is this a surgical? Do you have to cut open to get to the bone? Can you just stick the syringe through the muscles? How does it work?
We do not have fluoroscopy, so we definitely did a lot of pre-op planning. So the dog is anesthetized, and I actually used sterile surgical staples as my markers for planning as I was getting pre-op radiographs. So unfortunately, we didn't have fluoroscopy, but we were still able to. So that's a real-time radiograph.
Oh, okay.
So you're seeing what's happening in real time versus snapshots in time.
So it's like a movie version of an X-ray rather than a photograph version of an X-ray. Yep. Okay.
Yes. Unfortunately, it's quite expensive and not readily available, but we make it work without it. So with this, depending on which bone you're working with and where the site is, the animal is anesthetized. You do make an incision based on your planning on how you're going to approach the bone, but it's typically a very small incision, 1 or 2 inches.
Okay.
And then
you don't have to like flay the dog open. You can do very small incision.
Not at all.
Okay.
We just need to access that bone in order to drill a small hole, access hole, to get to the tumor and remove as much tumor as we can, and then inject product.
So you go in, you remove the bone tumor, and then you fill up the hole.
Once you have that access point and the correct angle, you can kind of tell when you're getting into that bone tumor. It just feels a lot different. And then we used a lot of surgical flush, suction. We actually sterilized bottle brushes and use that to kind of decorticate tumor and get it out.
To scrub out the inside of the bone, basically.
Essentially. And that was just innovative thought.
Yeah.
Like, we wish we could just scrub this out. And I was like,
we can. We have the tool. It's called a bottle brush. That's incredible.
Yeah. So once you're satisfied that you've removed as much as you can and you have a nice cavity to fill, you just put the adapter on the syringe. And the first time I did it, I just started, you twist it, you don't push it. And as I twisted, as it filled the cavity, it started to push the applicator out. So I was like, I guess I know it's filling well because it's pushing me out of here. So perfect.
Oh, and then you take an X-ray or a radiograph to verify that you've gotten it in. Well, that's really fascinating. And then how long does it take to harden?
So normally in 24 hours. So the product becomes to harden only when it is in contact with fluids. Call it blood, call it body fluids, water, if you want to make an experiment on your table. But the moment that the product has contact with fluids, then the crystallization reaction will start to happen. So that moment starts the setting. After 15 minutes that the product is in contact with a fluid, you will start to see that there's like a crust forming on it. And at 24 hours, for such high volumes as the one that are injected in osteosarcoma, you will have between a hardness comparable to cancellous bone. So we are talking about between the 10 and the 25 megapascals, which is already very good. And after 4 days, because we're talking about big volumes in osteosarcoma, you will have 45 megapascals, which is extremely hard. It's become very, very hard, and it's designed to hold these compression forces on long bones. which will be the weight-bearing forces that will occur on the bone, and the product. But what the product does is to withstand these forces exerted on the bone and alleviate the pain this way.
Relieving pain is the number one goal.
Yes, I think that the main goal of the cementoplasty in both humans and our dear four-legged friends is to alleviate the pain and increase the quality of life of the patient.
Right.
There's no other reason to do it just than that. We are not trying to cure, because we are not going to cure the cancer. We are trying to improve the quality of life, to give a palliative care for these patients who are most definitely in need of a solution.
Okay. Dr. Stewart, would you use this instead of amputation?
Yes. So the first patient I used it on actually came to me because he was a 96-pound, really long-legged dog. And it was a forelimb that he had the bone tumor in. And dogs bear 60% of their weight forelimbs, 40% on the back. So that much weight, losing a forelimb, it's really tough for those dogs. And the owner did not want to amputate. And I had just found the bone cement weeks prior, and I said, hey, we can try this.
Hey, I'm kind of a cowboy. Let's try this.
Exactly. Yeah.
That's kind of how it worked out. I said, we're going to be winging it a little, but if you're game, because at the end of the day, if this doesn't work for whatever reason, he loses his leg, which is what's going to happen anyway. So, and she was like, absolutely, let's try.
That's great.
And it's fortunate we did, because Colt took a spill a couple weeks ago and injured his other wrist, the opposite foreleg. So he was actually limping on the leg we had filled with bone cement for a couple of weeks. He's recovered now, but he definitely scared me, certainly when I heard he was coming in for forelimb lameness. But she was like, no. He sprained his other wrist chasing a ball. I was like,
and the bone cement is making the leg that had osteosarcoma tumors in it fine. It can hold his weight.
It can hold his weight, and it can hold. It can kind of carry the team for the front half with an injured opposite forelimb.
Dr. Aqui, you mentioned that you're not trying to cure the cancer with us. Can you explain a little bit about why, how it's not a cure?
Well, osteosarcoma is not a cancer that you can cure. We are not, most of the time, you're not treating to cure cancer, osteosarcoma. We are trying to give a palliative treatment to diminish the presence of metastases, and we do that by giving chemotherapy. We are not offering a cure because we are not there yet, but once the medicine gets there, I'm quite sure that we will get on the boat and add the curative medicine to the product. At this stage, we are already started to find a way to mix the product with the chemotherapy that is normally given. Cisplatin, carboplatin. We're in the process of finding the way to mix them so that the vet can deliver locally also some treatment. And this way, probably not only increasing the quality of life, but prolonging the period of time in which the metastasis will appear.
So
this will need a lot of time and care and loving care. Mm-hmm. But I think that we're on the good path, and we are moving along with key opinion leaders that give us their opinion on the oncology part, which is very important because, to be honest, surgeons are more like cowboys, like Dr. Stewart, but oncologists are more apprehensive when you tell them that instead of eliminating the tumor, you are going just to eliminate one part of it by clearing the cavity and then replace it with a bone substitute or bone cement.
I have been looking into some pretty interesting osteosarcoma specific information, and there is surgery accelerated metastasis. So when you amputate osteosarcoma, there's always small tumor cells in circulation that break off of the primary tumor. And without getting too nerdy about it, I guess, there are cells in the lungs that when you amputate, change and consume the osteosarcoma cells. That's why you get metastasis primarily in the lungs. So I do have some interest in
the lungs specifically that react to amputation and then become more likely to be sites for metastasis.
There are macrophages, which are inflammatory cells that gobble up things that shouldn't be there, like osteosarcoma cells. And for some reason, when you amputate primary tumor, those cells in the lungs change and become more likely to go after these. So I feel like there is some actual benefit versus risk to leaving the tumor or some of the tumor, specifically with osteosarcoma.
Just to add a little bit on what Dr. Stewart said is that during this meeting at the European Congress on Oncology, I also discussed with other opinion leaders who are very interested in the technique, just because there's this theory that says that by leaving the limb, by keeping the limb, you're still keeping the inflammatory signal that is controlling the tumor where it is, and avoiding this metastasis to appear either in the lungs or secondary bones. So I think the cementoplasty is getting some. It's in the focus for discussion. It's not that they are not behind it. It's just that they need more information. What is happening at the location and how is this really helping or not.
The more dogs we get, the more dogs we get with bone cement, the more we can compare those to amputees. And I don't think there's quite enough dogs yet to make that comparison.
No, not yet. And the thing is that even when we need very large number of dogs, because we don't have an homogeneous population.
Right.
We do not have the same breed, same age, same level of advancement of the tumor. Then we don't have the same surgeon, which is a big factor always in in a study. You have to be as homogeneous as possible. So we really need a large number of patients. It's difficult, but we're on the way, and I think we are going to publish very soon an article based on the first formulation that we used, and we did a short study on it that showed that there was an increase in quality of life in the patients. And we keep gathering cases like Dr. Stewart, who is very reactive with us, and she is collaborating with us, and she's feeding us images and the clinical part of the patients. And like Dr. Stewart, we have a couple of vets also in Europe who are doing the same. So we are gathering this case.
When you do a cementoplasty, did Colt, your first patient, Dr. Stewart, also get chemotherapy? Are you continuing to do other standard of care for osteosarcoma patients?
He did. He did get 6 rounds of carboplatin, which is at least in the U.S., the kind of standard course following amputation. We started that, I think, 5 days after his bone cement, because you don't have to wait as long to start chemotherapy because there's not such a massive incision that needs to heal. So he did get chemo in addition to the bone cement. There is an immunotherapy where you submit tumor, and the company I'm familiar with is Torigen, but they haven't recommended using immunotherapy in conjunction with bone cement because the primary tumor is still there. So you don't really want to train the immune system to go after tumor when your primary is still there.
Okay. So
and then radiation is also an option.
Okay. So radiation therapy as well. All right. How long is the recovery period after you sew the dog back up and send him on his way? Is it the normal surgical recovery time?
With all of the dogs that have gotten the procedure, they do stay overnight on constant rate infusion of pain medication. Some people will splint limbs. I have not, just because they're not really moving around much and it hardens so quickly. And then Colt did have them restrict activity for 10 days, even though it was fully hardened in 4 days, just because I was being a little wimpy about it. But he walked out of the hospital 24 hours later, better than he walked in.
Most of dogs do go out walking the next day with some limping still, and they improve gradually in time. But there are also dogs who take more time to start walking back on that limb, especially in proximal shoulders, distal femurs, where the void and the bone lesions was massive. And especially when there is a lot of muscle mass involved, there's also a soft tissue inflammation component that we don't have to forget about. And it's in some cases in which we had a very nice filling of the cavity, and the dog comes back and has to be amputated or euthanized just because the osteosarcoma keeps working how it works and causes an inflammation of the soft tissue that eventually is too much to walk on it.
Okay.
I unfortunately have had that experience as well. I am a little more cautious with tumors that seem to be more proliferative versus lytic.
Define those two words for our listeners.
Proliferative is growing, making more bone, kind of like a plant would bloom out. Mm-hmm. Lytic is the tumors chewing up the bone, so you're just losing bone. Okay. Both are painful. Mm-hmm. And if you can remove that proliferative lytic, whichever it may be, and put in the bone cement, you're making them more comfortable. But the more proliferative tumors, or the tumors that behave that way, there's only so much room for them to expand before they're impinging on soft tissues. And even though the bone isn't painful because it's stabilized, it's making everything else around it painful.
I see. So a proliferative tumor might not be a good candidate.
I would discuss it with the owner. I'm concerned this may happen. And if you have financial concerns, then you might want to skip this and go straight to amputation. But okay. I wouldn't be opposed to trying, because cancer does what it wants, and I'm never gonna make that call and rule a dog out, because you never know.
A lot of listeners really do appreciate veterinarians who lay out all the options that are available and then let them make the choice rather than excluding things.
The reason I was drawn to veterinary medicine is there's so many new things happening right now and so many things to try. And as long as there's research behind it and first do no harm, I'm game to try it.
As a company, when you launch a product and you need people to try it and to stand behind it in front of a pet owner, it's nice to have someone like Dr. Stewart that is, how you say it, I'm having the word in Dutch in my head, but not in English. Yeah, innovative. Yeah.
Someone who's innovative.
We'll just also say that every time that we get a question, either from a pet owner or a vet, we always give them back feedback, especially to vets. At pet owner, I will not give the same kind of feedback like you should do this in the surgery, but the pet owners, we try to direct towards a vet in the region who's doing the technique. And with vets, what we do is be completely sincere, completely open, and say, look, this is not a good candidate. Don't use the product. We are not there just to sell. We are there to help you on the way.
What dogs would you say are not good candidates, Dr. Aqui?
Well, what we suggest as the minimum necessary is that you still have one cortical intact. So the bone, imagine a round bone, mm-hmm. and the osteosarcoma has been eating all of the sides, the cranial part, the front part, the lateral and the medial part, but you still have something on the back. Well, you need something that will support, so the product needs to give support to something.
Right. If there's a full break in that bone, this is not going to fill it in.
There have been cases where they have tried and the dog is doing fine for some weeks and then not anymore because we're not supporting anything. It's only the product that is supporting that bone. And the moment that the osteolosis keeps advancing, then the product cannot keep up. So the main idea is that you have at least one cortical bone intact, to which you are going to provide support, and that the patient doesn't have metastasis, because if the patient has metastasis, well, the prognosis is very bad.
How many dogs who are newly diagnosed with osteosarcoma would you think might be eligible for this?
I think one of the biggest things is where in the course of disease the dog is. So if an owner immediately sees their dog limping and brings them in and it's diagnosed, they're much more likely to be a candidate because it's early on, much less likely to have metastasis, much less likely to have a situation where we can't use the product because there's so much tumor there. So I think having owners that get their limping dog in really quickly gives us the best chance of being able to offer that option.
Yeah, that makes sense. I imagine dogs still need to be on pain medications.
Staying on pain medication or an anti-inflammatory in the patient population we run into, they probably need it anyway. So,
so you're not.
There's always the soft tissue component, especially in proximal humerus, distal femur, proximal tibias. The soft tissue component we are not solving, unfortunately. So there's always some kind of pain. Distal radiuses and distal tibias are the ones that we have seen that do not require. However, we know that some vets use disinflammatories as part of the treatment of the cancer. So it's even if it is not related to pain, there are some disinflammatories involved in the treatment of the dog.
For sure. Okay, so where do listeners go if they want to, if their dog is a candidate, or if they want to know if their dog's a candidate? Who's doing this besides you, Dr. Stewart?
I'm a general practitioner, so I think universities and referral centers are probably not as ready to jump on something new and try it because they're that's just kind of the nature of the beast.
Well, there's plenty of veterinarians, I'm sure. We have a lot of veterinarians who listen to our show, and I'm sure that their ears are perking up, and there's more than one cowboy out there. So
I'm sure of it.
My life motto is it'll probably be fine. So go for it.
Love it. All right. And then in terms of if a veterinarian were interested in offering this, is there special training that you offer at TheraVet, Dr. Aqui?
Well, we have designed, based on the experience of the surgeons who have been doing the surgery for the last 2 years, we have put together a step-by-step guide. If a vet wants to have some advice or discuss the technique, I'm an email away, a call away, and I'm always available. Everything is on the step-by-step guide, the tips and the tricks, and the mindset that you have to have.
Which countries in Europe currently offer cementoplasty? So we do have a lot of European listeners.
We have what we call the Osteosarcoma Centers of Excellence. That's a network of vets who have performed the technique and that open to receive patients recommended by us or from other vets. And they are based in Belgium, Netherlands, France, the UK, Ireland, Scotland. But the product is readily available to be sent worldwide. I think it's a nice solution, palliative treatment, let's not forget it. But it's a nice option for vets because normally what do we have now is giving bad news on bad news.
Right.
So giving them this option of having a dog still on 4 legs for the same time that they will be on 3 legs, well, let's try.
Well, I have so enjoyed learning about cementoplasty with the two of you. I'm wondering if you have any last words of advice for dog lovers facing osteosarcoma about cementoplasty or any other advice you have.
My advice as a vet and as a dog lover will be it is not the end of the world. There are options. Here we are offering one of them, not the only one. So keep an open mind and keep pushing through what it's expecting in the short future. Because dogs with bone tumors will suffer and the families will also suffer. And the vets are suffering constantly about it also because they have not much to offer. So I think it's something that we have to do all together and push towards a better solution, better approach all together.
Mm-hmm. Dr. Stewart?
In the end, do what's right for your pet, what's best for your pet, what's best for you, what's best for your family, and whatever that looks like. There's never a right or wrong answer when it comes to these things, but there are options available. When you get a diagnosis, don't take that at face value. Take a little time, process, and see what's out there, and don't make any snap judgments.
That is excellent advice from both of you. Thank you so much for joining us today.
Thanks.
Thank you for having us.
It's really exciting whenever we can bring a new technique to you to help your dog with cancer. And of course, that's always our mission at Dog Cancer Answers. Check out our show notes for more links. There's lots of shows on osteosarcoma that you should pay attention to. And I hope that that's useful to you and helps you serve your dog. Subscribe and follow us and pay attention to our socials because we're always posting more information about old and new things that can help dogs with cancer. We'll see you soon on Dog Cancer Answers.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.